Good afternoon, everyone. I'm really sorry that I'm not able to be with you in person to celebrate the 40 years of TCRU, but I'm delighted to have been asked to say a few words about Thomas Coram and the heritage that he has left us, a little bit about his life and the extent to which the values and the work that he set up back in the 1700s is still relevant for the work that TCRU is doing today. What kind of man was Thomas Coram, and how did the hospital get set up? He was born in Lyme Regis. His mother died when he was young, and as a very young lad he was sent to sea. As he continued with his seafaring career, he built up a trade in the building of boats and based himself in Taunton, just south of Boston, in the developing Americas. He married but was never able to have children, and during a lengthy career as a shipbuilder and developing the provinces of New England, he gradually, as he came back to England, began to despair of the poverty that he found and the children that he found dying on the dung heaps in London. He then spent what turned out to be 17 years on his darling project, persuading the great and the good, and the wives of the great and the good, the aristocracy, to support his idea for a hospital to take in illegitimate children. This was to be England's first children's charity, based on the models in Europe, but not linked into the church. This was an organisation that over the years until the early 20th century took in 27,000 children. It was called the Foundling Hospital, but these were not foundlings. These were illegitimate children whose mothers brought them in to the hospital, which was in effect a boarding school, and managed to persuade the governors that they would lead blameless lives and useful lives if their children, their illegitimate children, could be looked after. The institution itself offered really quite high quality education, healthcare from the Queen's physicians, a good diet. It offered a huge amount that the parents of these children or the mothers of these children could never have offered themselves. What it didn't offer, as a large institution, was the love and the cuddles, the emotional support these children might have wanted. The governors took their responsibilities very seriously, and even after the young women had gone into service at 15 and the young lads had gone off probably into the Navy or the Army, the governors had a responsibility for these children until they were 25 years old, something it does us well to remember in these days when we are concerned about young children, young people leaving care with very little support. The Foundling Hospital was pulled down in the 1920s. London had come up to the gates. It was dirty, very institutionalised, busy, and eventually the children were rehoused in a school at Berkhamsted. But the governors retained a patch of land in Brunswick Square where they built their headquarters that handled new admissions to the hospital, as it was still called. And they also set up a child welfare centre with luminaries such as Susan Isaacs leading the work. Roll forward to the 1970s and Jack Tizard came into discussion with the governors of Coram about the possibility of setting up a combined, what we would today call an early excellence centre, a combined nursery centre, bringing together care, education and health for young children under 5 and support for their families. And that was the beginning of a long association between what is today called Coram, the current work of what was the Foundling Hospital, and the Thomas Coram Research Unit.
It began in the late 1960s, really, when government became interested in trying to undertake more research which had a bearing on social policy and health services policy. And I had a number of grants from DHSS and from other government departments. And negotiations began about having something of a unit which would combine these grants and give some sort of security of tenure to the people who were engaged in the work. At that time, I think the idea on the part of DHSS was that there should be the equivalent of a medical research council establishment set up to do work which was strategic in importance, but concerned with health service issues as opposed to biomedical issues. However, I think our unit, it's true to say, has been much more concerned with strategic issues, if I may use that term, and has been concerned with developments and with issues that we feel are going to be very important for the country in the 1980s rather than the 1970s, although of course much of our work, we feel, has an immediate implication for health services policy. There was to be research on young children and their families looking at the consequences of nursery expansion and preschool services, the expansion of preschool services in this country, which of course is something which has happened in all industrial countries over the last few years. So that was the first one, to look at the health and education and day care of young children in an ecological context, and to consider also the health of their mothers and the way of life of women in this very changing society in which we live, and the way in which services could facilitate and improve the conditions of life of families, particularly in urban areas.
A major part of the unit's research is the preschool child. Their concern for measuring malaise and finding ways of remedying it has to be turned into a research proposal. This means a design or plan for carrying out the research.
The idea was to set up 2 centres in different parts of London to make them available to young children, really from birth onwards, whose families desired to avail themselves of the service. Now, we were very concerned that the service shouldn't be concerned just with the children. We wanted to also to consider the children in a family context. And so we grafted onto that rather simple proposal 2 other elements. One of them was a paediatric element, and we've got a strong paediatric team here. And the other element was to look at the ways in which families were coping with young children. We've got 2 areas in which we've got these demonstration centres set up, and we've got a control area. And in these 3 areas, all families with young children are being interviewed, questions are being asked about their way of life, about the mother's health, about the problems they have with their children, and so on. So we're building up a picture of the ways in which families from different origins and of different social classes see their problems and the kinds of expectations and aspirations that they have for their children. And what we've done here, under Peter Moss and with a very experienced team of interviewers, is to interview all families with young children in the catchment areas.
The first one I have on my list is family 11176.
So can we draw parallels then between the times that Thomas Coram found himself in and our times today? Well, clearly there are very few children now abandoned on the streets, but there are still many children whose families, for whatever reason, find it difficult to care for them. So there is still a huge need to champion the needs of the most disenfranchised and most disadvantaged children and young people. Children and young people who can't raise their own voices and who need others through hands-on projects and through research, which is then well disseminated, to speak on their behalf, listening to their views. This has huge implications, I think, for organisations like TCRU in the 21st century. There are important issues that relate to policy. How can we persuade government that children and young people matter, that children and young people's priorities should be their government priorities, particularly at times of financial cutbacks and when there are so much competition for public money? How can we ensure that professionals work effectively together, based and focused on the needs and the rights of children and young people across health and education, social care and housing? How can we ensure that we listen to the voices of children and young people and don't just assume that we know what is good for them? How can we ensure that families struggling, as so many families are today, are given the appropriate support to help them stay together as a family? What does research tell us about what kinds of interventions work well? What do we know about children's well-being and how best that we can support that. So there were all kinds of ways in which, through specific pieces of research, but also through wider bodies of research, such as the Child Wellbeing Research Centre, we can listen to the needs of the most disenfranchised and most disadvantaged children. We can remember that these children, whilst they may spend time in care and the experiences of care always need to be improved, also need support in staying with their families. I know that the TCRU has done research with Coram itself over many years, looking at adoption and concurrent planning, for example, and has looked at the impact of social pedagogy approaches, particularly in Europe, and at the experiences of young people in care and their need to go on to further and higher education. And I'm so glad to be able to say that TCRU, at its first 40th birthday, is withholding and maintaining so many of the traditions that Thomas Coram set up all those years ago.